Okay, thank you. Good afternoon and welcome everybody. I'm Scott Earnest, Associate Director for Construction in the Office of Construction Safety and Health at NIOSH. Along with CPWR and OSHA, we're holding a new bi-monthly COVID-19 webinar series for the construction industry. Our first webinar was on June 3rd and covered data-driven insights on job site activity. CPWR has a new playlist on YouTube where you will be able to access that and the recordings of each webinar in the series. Jessica Bunting, our WebEx host for today, will share that link with everyone in a follow-up email. Jessica is also online to handle any technical issues and assist when needed. If you're experiencing difficulties with WebEx or with your audio, just message her in the chat box or send her an email by responding to the WebEx registration or reminder emails. If you lose audio at any point, please call in using your phone. Call-in information can be found in your WebEx emails or on the PowerPoint slide on the right, on the screen on the right. As I mentioned, Jessica is recording all the webinars in the series, including today's, will be sent out to everyone along with a PDF file of the slides after the event. We're planning on saving some time for Q&A at the end of the webinar, so please enter questions in the Q&A box at any time. We also received a number of questions in advance, so we'll try to get through those and answer some live questions as well if possible. So before we get into the panelists, I just wanted to give a few updates from the Office of Construction Safety and Health at NIOSH. We've been extremely busy ever since the pandemic began. A lot of our work's been done with partners through our NORA Construction Sector Council and a work group we set up. In addition to all the activities with the work group and webinars we've been involved in, we've got some new research projects that I thought you might be interested in. There was actually a total of 21 new research projects that have been funded in the last several weeks. And this slide just shows a number of them that are relevant to construction. So we've got a new research project on fit capability of respirators without NIOSH certification, evaluation of decontamination methods of respirators, a study looking at extended N95 respirator wear on facial thermal burden, a study looking at evaluation of mobile apps for digital contact tracing, a study looking at the point of use of air purification systems, and then at the bottom, we also have a study related to suicide surveillance during the pandemic. And as I'm sure many of you know, suicide has been an issue in the construction industry before the pandemic, and the stress of the pandemic, I'm sure, has increased that level of stress. Also wanted to point out a recently published article of interest. This was published in the Journal of Infectious Disease. The lead author was Trout, and the title of it was Airborne SARS-CoV-2 is Rapidly Inactivated by Simulated Sunlight. And this study looked at the effects of simulated sunlight and relative humidity on the stability of COVID in aerosols. And they looked at the simulated sunlight and relative humidity, but the relative humidity alone did not affect the decay rate. But the results of the study, the findings were that the potential for aerosol transmission of COVID may be dependent on environmental conditions and particularly on sunlight. And so this data can inform mitigation strategies to minimize the potential for transmission. The reason I'm bringing this up, I mean, again, this is fairly recently published, but a lot of construction work occurs outside, and so this could be a very positive study for construction and other outdoor work activities. I also wanted to just briefly mention that on the NIOSH website, they've updated a section related to testing of international respirators. I think as many of you know, more and more respirators have been used from outside the U.S. Because of the shortage that we've had. And the link to this website is at the bottom of this slide. But for each model listed, there were 10 respirators that were submitted for evaluation, and the samples were tested using a modified version of NIOSH's standard test procedure. And they looked at particle filtration efficiency. But again, I want to just point out that there's really a wide variety in terms of the performance level of some of these respirators that are coming in from outside the U.S. As you can see, like particularly at the bottom here, there's a respirator that was tested, and the efficiency was down around between 50% and 33, 34%. So just wanted to point that out. And then also I wanted to mention that on the NIOSH website, there's information about coping with job stress related to COVID. This is an area that's often overlooked, but it can be extremely important. And if you take a look at this website, it gets into measures that workers can take to try to help reduce stress. And some of that has to do with just keeping a regular sleep schedule, taking breaks from work, exercising, interacting with supportive colleagues and coworkers, trying to spend time outdoors or get physical activity. If you're working from home, try to have set schedules as much as possible, and just doing things that you enjoy during non-work hours. And then finally, I just wanted to include this slide that shows a number of different links that could be of use to all of you. And with that, we'll go ahead and get into the main part of the webinar today. And so we're going to start off with OSHA, and we've got two speakers from OSHA. We'll be starting with Chris Brown, who's a special assistant in the Office of the Assistant Secretary at OSHA. And along with Chris will be Tim Irving, who's a Deputy Director and a Director of Construction. When they are done with their presentation, that'll be followed by a brief update by Chris Cain, CPWR's Executive Director. And then we'll finish things up with Dr. Doug Trout. He's Chief of the Hazard Evaluations and the Technical Assistance Branch at NIOSH. So with that, I'll turn it over to Chris Brown and Tim Irving.
Thanks very much. This is a little bit about some of the OSHA resources and what OSHA is doing to respond to the coronavirus pandemic and help ensure the continued safety and health of workers in construction and across a variety of other industries. Sorry about that. We'll try to press ahead, and if it gets unintelligible, let me know, and we'll switch, or perhaps Tim can pick up with his portion of the slides if you're unable to hear.
That sounds pretty clear right now.
Okay, great. All right, and I think the slide should be advancing now. So I wanted to just talk a little bit about what OSHA is doing in general and emphasize that we've really been coordinating across the federal and interagency since the start of the pandemic to make sure that the guidance we're providing reflects a whole of federal government approach here. And we have been coordinating very closely with CDC and NIOSH and overall trying to make sure that we're providing a clear message to both employers and workers, and that's that employers should have a plan for protecting their workers and preventing further spread of disease, as well as maintaining the employer's day-to-day functions. So we've been trying to provide a variety of resources that help with that aim so that employers have the ability to continue to protect their workers from coronavirus, including as folks start to return to work, as well as to help make sure that employers are able to continue their daily operations given the current pandemic situation. As many of you may know, the risk of exposure in workplaces likely reflects what the general public is experiencing in the community where the workplace is located. But workers do have a risk of exposure that increases when they have frequent close contact with other coworkers as well, or members of the general public. And our guidance is largely structured around this type of risk and where we've identified that happening. And many people are well aware that there's a risk to workers in the healthcare industry, but OSHA has been working with our partners to try to identify and provide materials for workers in other sectors where there's occupational exposure risk during the COVID-19 pandemic. And that can include workers in sectors like construction, oil and gas, manufacturing, food processing, and a number of the other sectors where we've already begun providing guidance materials since early on in the outbreak. Our guidance materials are largely structured around the risk pyramid that we adapted from the H1N1 materials that we provided back in 2009. And our risk pyramid is meant to break down exposure into 4 levels: lower or caution, medium, high, and very high, to help employers and workers recognize the types of activities they're doing in the sectors they may be working in that are associated with these levels of risk. Most types of workers, because of their exposure to either each other in the work environment or to coworkers or to customers, members of the public, visitors to work sites, and others, are generally in the medium risk exposure level, or the medium exposure risk level, or the lower risk level. Employers need to carefully examine the specific risks in their workplaces and make sure that they're planning accordingly. And OSHA's guidance materials provide detailed recommendations for a variety of different types of industries about how to implement the hierarchy of controls for workers at each risk level within the pyramid. Generally, our guidance looks very similar to, I think, the guidance that you're probably seeing already from a lot of other agencies as well, because we're trying to underscore the basic hygiene principles that can help keep workers well on the job. And this includes things like practicing good and frequent hand hygiene, increasing cleaning and disinfection of common surfaces, implementing physical distancing between workers to maintain at least 6 feet between people, using appropriate PPE when it's necessary, including when other types of engineering and administrative controls aren't sufficient to protect workers on the job, and then using flexible leave policies to help ensure that sick workers don't feel like they need to come to work and potentially spread the virus to others. So all of the resources that I have highlighted here are going to be available on the OSHA.gov coronavirus page. If you're not familiar with that already, I encourage you to check it out, and you'll see that on the main page, we've broken down all of the information that we're providing, both by industry sector and by type of material. So you can find detailed guidance for a variety of different industries, including the OSHA guidance and the guidance that we developed jointly with CDC and other federal partners, as well as one-pagers that are meant to break down our information into bite-sized pieces that have been provided as OSHA alerts. And those cover general tips for infection prevention and helping to keep workers safe and healthy in a variety of different types of industries, including beyond that where we've provided detailed guidance already. So you can find those for about 10 different industries on the main page of the OSHA site. As well, on that main page, you'll find information about our current enforcement approach, which is detailed in our enforcement response plan, as well as information about the flexibilities that we're offering in the way of enforcement discretion for a number of the OSHA standards, including the respiratory protection standard, in an effort to try to make sure that employers can access respirators that they need to protect workers, given the types of shortages that we have seen throughout the course of the pandemic in various parts of the country, as well as issues that we've become aware of where employers are having difficulty getting the types of training, testing, assessment, and other services that they may ordinarily need to comply with the OSHA standards. So those are detailed in enforcement guidance memoranda that are available from the OSHA.gov coronavirus page as well. I mentioned the OSHA alerts and just wanted to show you what those look like and mention a few that are available for a variety of different types of jobs and sectors. We do have one for construction, one covers manufacturing, package delivery, retail, and again, a number of others that are available on the OSHA site. So that's the overview of the resources that we have available. Again, the link to the main coronavirus web page is at the bottom here. Now, I'm going to turn it over to my OSHA colleague to continue presenting a bit more information in detail about our guidance for construction. So Tim, turning it over to you.
Thank you, Chris. I appreciate that. And my name is Tim Irving, and I'm the Deputy Director here in the Directorate of Construction in OSHA's National Office. I just want to emphasize that it's important for workers to understand what Chris was just discussing about the exposure risks in the community monitoring. They really need to understand that the risk not only at home, but how it affects their work as well, and that the risk can transfer from home to work. And the training really needs to emphasize, as Chris mentioned, the self-identification is important, and understand the way that the virus is transmitted is key, and understanding why these precautions are being taken on the job site. With them understanding why they're being the precautions are being taken, it'll help with the compliance on the job. So construction workers are great at what I call take-home safety, meaning that they'll wear their safety glasses, boots, gloves, respirators while doing home projects. An example of that is next time you see someone mowing the lawn with flip-flops on, I guarantee, or I seriously doubt that they're construction workers, because they understand the risks of the tasks that they're doing. Well, now it's time to take that home safety back to work. The face coverings that we've all been wearing, the washing, the social distancing. We really need to emphasize that they are protecting not only themselves, but they might be protecting their coworkers or family members of their coworkers as well. The slide up here now, the construction work tasks and associated risks, I want to throw a shout out to the CPWR, because if you are looking for a way to analyze these risks, there are documents on their clearinghouse. They have some checklists and other documents that can be incorporated into your individual site plans. Chris was mentioning the risk pyramid, the lower or the caution, the medium, the high or the very high. The lower risk is where we're seeing most of the construction activities are going to be falling. Examples are painters. If you're in an individual room and you're painting, you can be by yourself, minimum risk to exposure to other workers. Site work. Some jobs might have multiple categories, might go from lower caution at one point to medium. If you're doing site clearing and prep work, that's a lower caution. But if you're actually entering into an excavation where there's more than one worker and you need to have multiple workers in the trench, that might bring you up to the medium task, the medium risk. It's all going to be based on the tasks at hand. Another example is framing. If you're individual stick framing, you might be able to social distance. But if you're looking at raising a wall with a group of workers, that again is going to change that particular risk. And it's going to be analyzed for each particular task at hand, whether it's steel erection, the electricians, the pipe fitters, where you're going to have to take a look and analyze each of those risks. An example of some of the medium category risks, the working at the elevator or the hoist or confined space might be a medium risk, where you have to be in an enclosed space with other workers. Manually handling of material, or say you're working in a scissor lift or a boom lift with a coworker. Those might be medium category type risks. And looking at the high or very high, those are going to be something that your organization's going to need to assess on an individual basis. And understand that these risks will change during the project as the construction changes. Some safe work practices. Adopt staggered work schedules. And this goes into public transportation. How do your workers get to the job? Are you out in an area where there's plenty of parking? Are your workers carpooling together? Are they in the parking lot together? Are they hanging out, and are they congregating in the parking lot waiting for their work to start? Provide alternating work days or extra shifts. Now, not all jobs can do that. There might be regulations that prohibit the night work or extra shifts. But are you working Saturdays? Are you working second shift, third shift? And the intent of that is to reduce the number of employees on the job at any one given time, which will assist with the physical distancing. Identifying some of the choke points, such as the gate entering into the job site. Is that a choke point where they're forced to, where the workers are forced to gather? The elevator or the hoist at the beginning of the day or at the break time. Are the workers forced to wait in line for the hoist to get up to the upper floors? Hallways, are there directional arrows for one-way hallways? Not always an easy thing to do on a construction site. Again, any of the entrance or egress points, your break areas, common water, common food, those all have to be analyzed. And we're saying that your common water might need to be removed or not be used anymore. Individual water bottles. Are the workers coming by bus? Are they going to a local parking area and being bussed into the project? So you need to look at all of these things to maintain the social distancing. So, and again, it's not always easy for the elevators or the personnel hoists to keep 6 feet apart. Is there extra time for the workers to get up to the job, to their workstation? Some of the other safe work practices, coordinating site deliveries in line with the employer's minimal contact. You know, a lot of time the site delivery guys, they've been sitting outside for a while and they need to use the restrooms. Well, do you have a plan for that? Are there one-way roads in and out for the material handling? How are you handling the delivery personnel? Are they staying in their vehicles? Now, housekeeping has always been an issue on construction sites. Instituting a rigorous housekeeping program to help reduce dust levels. But it's going to be taken to the next level. Are you cleaning your tools? Are you sharing tools? How are you doing it? How often are you doing that? Keep your in-person meetings, the toolbox talks and the safety meetings, keep them shorter than they have been. Can they be done outside? Can you hold multiple meetings, which will help limit the number of workers? And where you are holding the meetings, are there markers where the employees know that they can stand, that they're going to be abiding by the social distancing? One of the things is ensuring the clean toilets. That's something we always want on the job site. But now we're seeing a lot more of the hand washing facilities with running water on the job site. Some job sites are requiring that you wash your hands as you enter them. This is something that it's going to take a little getting used to. Clean and disinfect the portable toilets on the job sites regularly. Fill the hand sanitizers dispensers regularly. Want to make sure that they're not running out. Is there someone that's inspecting them and checking them on a regular basis? So, the cloth face coverings. OSHA is aware that these can be hot, and we think if you aren't aware of the Water Rest Shade program that OSHA has, we've been doing this campaign for about 10 years now. It's a good opportunity to help raise awareness with these face coverings. We are recommending the cloth face coverings as a protective measure. They are not PPE. The cloth face coverings are not PPE. They're face coverings. And it's also important to keep social distancing when you're wearing the just the cloth face covering. We want to emphasize that to keep up to date with the ongoing information, this information is changing rapidly. If you haven't subscribed to the OSHA Quick Takes, it's a bi-weekly newsletter. We have just about 287,000 subscribers. We also have a tip of the day that goes out. You can follow us on social media, on Twitter. And you can see there that we only have 21,500 followers. We could use the love there on the Twitter to get a few more followers on that. We have 287,000 subscribed to the Quick Takes. OSHA also has a Facebook page. And there is also a Department of Labor YouTube page as well that's not listed there. Just on another promotion here is the Trenching Stand Down Week. That is actually happening as we occur. There's events ongoing right now all around the country. Last year we trained about 50,000 workers on during this week. We also have cooperative programs for the smaller companies under 250 employees. The on-site consultation program is a good recommendation. The one issue with that on the construction site is that you definitely want to make sure the general contractor is aware of that. That if you're going to be having on-site consultation come on the site. In the Safe and Sound Week, which is a program to emphasize the safety and health management systems, goes hand in hand with the COVID-19 because with the COVID-19 program, you definitely want to monitor the success of the program. You need to get some feedback, and if the feedback, depending on what the feedback comes back like, adjust and mitigate as required. And I think we're going to hold the questions until the very end. I'm going to turn it back over to Chris Cain now.
All right, thank you, Tim. Thanks, everybody, for joining us. I'm going to be brief. I just wanted to go over our clearinghouse at CPWR. We've recently stood it up to try to collect information about COVID-19 and dealing with it in our industry in one place. And this is the web address. It's www.covid.lcosh.org. And looking through the questions that you sent in prior to the webinar and some of the ones that are flowing through here, we've got a lot of those answers in this clearinghouse. So I do invite you to come take a look. This is one page on the clearinghouse where we have most recent news related specifically to construction and COVID. It's not, the best news source in the world for COVID nationally, but it definitely, we try to hone it in to a few recent items related to COVID in our industry. Here are the categories that we have in our clearinghouse. You can see from these categories that we're covering a lot of the questions that are coming in, and we try to share as much information as we can. I'll talk a little bit more about the categories in a moment. Here's an example, though. If you click on a category in the box on the right of the screen, we're going to pull up the resources related to that category. This is an example of employer recommendations and requirements, and we pulled in things from the CDC, from OSHA, from wherever we can find them, from trusted sources. And if they're from, say, a company that we don't know is a verified official source, we have a procedure where we vet the material before we post it, hoping that it is of the best quality as possible. Here are the different categories, and you can see we've got a lot of categories, and things can fit in different categories, but one of the questions that came in was related to training. We do have training resources on the COVID-19 clearinghouse, including videos, presentations, toolbox talks. You can integrate them into different training programs as well. We also have published a guide for training centers on how to implement controls for COVID-19 if you're doing in-person training. So we invite you to take a look at that and share it if you'd like. Some other categories here are state and local requirements. A lot of the things around masks are driven by local or even county level governments, could be driven by a state government. So we're trying to collect different governor's orders or municipality orders into one place. And this is hard to track, so we need your help. A lot of the science that's coming out, it's coming out in tidal waves. You talk about a tsunami from the federal government. It's in the science that's coming out right now, and all of these peer-reviewed journal articles are now available for free on the web. So we link to some good journal articles if you really want to get into seeing what's going on about COVID-19 and how it might pertain to, say, the spread of the disease and that type of thing. We talk about personal protective equipment. People are asking questions about K95 masks, cloth face coverings. What are surgical masks? What's the difference? When do I use what? So we have a lot of different documents related to personal protective equipment. Another question that's come in just live on the line is about mental health. I mean, this is a stressful time for everyone in the United States and around the world. We have a situation in construction where workers are disproportionately affected by suicide and affected by opioid overdose. So we wanted to establish a resource page within the clearinghouse for mental health resources to help workers and employers get through these difficult times. And also, of course, we're pulling podcasts and webinars such as this one and linking to ones from other organizations we think are important for the industry. But we need your help. We really want you to share resources that you identify and send them in to us. COVID19@cpwr.com is an email address we set up for this purpose, and we're looking through this email box and trying to identify additional resources that we can load into the clearinghouse. One of the great things about being a nonprofit, private sector organization in this sense is I can pull things from a lot of different sources, and I don't have to go through 18 layers of government to share them with the industry, and that's what we're trying to do here. I know this was quick, but with this, I really wanted to make sure that I turned it over to Doug Trout with NIOSH, as we have a hard stop for him at 3 o'clock. And with that, Doug, I'll turn it over to you. Thank you.
Great. Thank you, Chris, and Chris Brown, and also Tim. So I will try to keep my comments to sometime under the time limit so that we will have some time for questions and answers. I'll do my best. But I am going to really focus on a couple of selected issues, and I think I am going to somewhat complement Chris Brown and Tim's talk when I'm going to talk about symptoms. They mentioned symptoms and symptom screening, and also I wanted to just echo what Chris Cain just mentioned, that SARS-CoV-2 as well as COVID-19 illness are novel. It is a novel virus and a novel illness, and there is a tsunami of information. And one of the challenges is making some practical recommendations that can be done from day to day on the work site with all the information that's coming out. And that's really where I'm going to get to in my talk with this outline. I'm really going to try to focus mostly on the issue of symptoms and symptom screening. And it sounds like a very simple topic, but I'm going to just I want to get into that because I think that deserves a little bit more talk. And hopefully I'll be able to give you a brief update on some testing, virus testing concepts, how they might be applied in the workplace, and also a brief overview of contact tracing. So as I just mentioned real quickly, I wanted to just put this right out there. I'm going to skip over some of the real important parts of the hierarchy of controls and some elements. I'm not going to discuss a comprehensive program that we all know is very important and that I think all the preceding speakers have mentioned, because specifically I want to get into the topics I just mentioned, which is I'm going to start with a little discussion about symptoms. And I think we all know the terms and the concepts are commonly used. They're seen all the time in various guidance documents, and appropriately so. But although it sounds kind of simple, I think the topic deserves a little more attention in terms of actual implementation. So I think you probably, if you haven't already, you now know that there is a CDC document called What Construction Workers Need to Know About COVID-19, essentially a fact sheet, and you will see in there some mention of symptoms. For example, it says that workers need to notify their supervisor and stay home if they have symptoms, quote unquote symptoms, and follow the CDC recommendations if they are sick. There are also recommendations for the employers that refers the reader to the CDC, what's called the CDC interim guidance for businesses and employers, which talks about symptoms. But in this fact sheet, there are a couple of sentences that talk about the fact that to reduce transmission among workers, employers should actively encourage sick employees to stay home. And we'll talk more about, and that's kind of what I'm getting at. What is sick, and how is someone to interpret when they are sick? A second point that I want to mention in this fact sheet is that the fact sheet does recommend, I think we've already covered, that work sites and workplaces provide educational posters in accessible areas related to the signs and symptoms of COVID-19. Briefly mention for Chris and Tim, just another plug for the OSHA document that's titled Construction Work, and you'll see that it has a lot. When you look at this document, it has a lot of good information in it, and it does mention the signs and symptoms of COVID-19, among other things, and that the OSHA document also mentions that to the extent possible, work sites should screen all visitors on construction sites for signs and symptoms of COVID-19. So we mentioned the tsunami of information coming out from many international, national agencies, and CDC and many others are really trying to provide the best available evidence to create useful and practical recommendations. And here is the current list of symptoms that have been associated with persons who have COVID-19. And you'll notice if you follow this topic, you'll notice that it's changed over time. And this is not meant to be confusing. This is meant to be as state-of-the-art as possible with the best evidence-based information possible. But you'll note also, and we'll get to this fact, that some of these symptoms are fairly non-specific. In other words, they may be very common and not necessarily associated with COVID-19. So I think my first point is that how does the average workplace or the average worker, how are they supposed to think about this list of symptoms? And I think go back to the kind of the clinical world, and possibly the best thing that we can say about this issue in a short discussion is that these types of symptoms should be considered of potential concern, particularly if they are either new or if they're chronic and, or maybe common, if they're different than usual. So that's just a simple addition that, we don't see in this guidance, but I think it is a useful way to think about some of these more common symptoms. So are they new or are they different than usual? And for example, a specific way a medical doctor or a clinic or a medical professional might ask this is if, related to shortness of breath, you might say, do you have shortness of breath? That's not as helpful as saying possibly, do you have unusual shortness of breath or shortness of breath that, that you find uncommon? And that type of question is also helpful for some of these other symptoms, for example, fatigue or headache, or or even for congestion or runny nose. Obviously, if you're in an area where there's seasonal allergies, that could be a problem. So that type of interpretation of how to ask these symptoms can be very practical and helpful as you think about educating your workers or your screeners. Now, moving on, just quickly, I'm going to show you just a couple of documents that address the topic of screening for symptoms at the workplace. So the CDC construction fact sheet refers people, as I mentioned, to the general business guidance, and there's also frequently asked questions. And there, just highlight this point that screening employees is an optional strategy that employers may use, and that's the CDC policy in terms of how screening programs should be applied on a high level. In some specific examples, for example, the meat and poultry processing workers guidance, there's similar language. It says screening meat and poultry processing workers for COVID-19 symptoms is an optional strategy that employers may use. And we'll mention, collaboration and consultation in a minute also. But you'll see that options to screen workers for COVID-19 symptoms include screening prior to entry into the facility. Of course, providing if you're screening verbally in an appropriate language, many workplaces have developed nonverbal posters, signs to help with their screening efforts. And importantly, and specifically for this guidance, the screening process advises that employees should not enter the workplaces if they have an objective fever, and it's defined as 100.4 degrees or greater, or feelings of feverish, or if screening results indicate the worker is suspected of having COVID-19. So I've just picked out a couple of other examples. I'm not focusing on this New York City fact sheet. I just want to point out you've probably all seen that things like this are very common in guidance. It says, as part of this fact sheet, symptoms of COVID-19 include, and it says supervisors should monitor workers for the symptoms. If anyone is symptomatic, send them home and do not let them on the site. So, that's a very high level thing. It sounds simple, but actually how do you implement that? It can be a little difficult. And then lastly, in terms of my examples, this is a document from the state of California that's titled COVID-19 General Checklist, and they also just mentioned screening. I just wanted to point out another example, individual control measures and screening, symptom screenings or temperature checks, and it says conduct screening for non-employees entering the job site. So here's what I want to recommend in terms of some things that I'll propose as ways to implement this, and also for you to think about. First, I would like to probably the most important thing, and it gets to some of the things that Tim mentioned, I think specifically about training, is that let's remember the purpose of why we are considering these symptoms and considering screening. We're attempting to minimize the number of individuals who might have COVID from entering the workplace to try to minimize transmission. Getting back to our typical hierarchy of controls, as Cain pointed out, this is an attempt to eliminate the hazard. But we know with this virus that elimination, in terms of the hierarchy of controls may, due to the difficulty of features of the virus, it may not be possible. So it's also an administrative control to try to minimize person-to-person contact among workers. And another important part of this first point is that education and training are key and should be part of every workplace occupational safety and health plan. Everyone, every worker, and every supervisor should understand why workers are being asked for these types of symptoms, and should be educated and trained on the importance of not entering the workplace if unusual symptoms are present and or if they think they are sick. So secondly, directly related to that, I think it's not pointed out quite well enough, although it is in some of our guidance, that it's important to instruct individuals on how to self-screen, essentially all the time. So basically, prior to coming to work, they may identify themselves as being possibly sick or symptomatic, and that will eliminate some of the difficulties of screening and symptom checks at the workplace. So this basically means keeping track of how all of us should be keeping track of how we are feeling and understands when new symptoms that might be consistent with COVID are occurring. If these couple of things we just mentioned, that is education on the symptoms and educating on why people should self-screen are in place, we can really, I think, take a big step towards helping, with this administrative control at the workplace. And third, an important part also mentioned, I think, earlier in our talk, is that providing paid sick leave and flexible leave policies are both important ways to remove the incentive for people to work while sick. So employers should have sick leave policies which are as flexible as possible and as non-punitive as possible for those workers who are feeling sick, so they don't feel the need to come to work while sick. Before I get to the testing, so a couple more things. So if a workplace is going to conduct screening, there needs to be a well thought out plan developed for that workplace, and ideally collaboration with local and possibly state public health authorities, and ideally local occupational medicine providers. All the details of this type of screening plan are beyond what I can talk about in a few minutes, but a couple of things I want to mention. One is, ideally there would be consultation with some subject matter expert, a healthcare provider or an occupational health expert on several things, including what I just mentioned. How to ask about symptoms. Will you be asking, just throwing the list out there, do you have these things? Or will you be asking about new or unusual symptoms that are different from usual? For example, some organizations we know have developed, with the advice of occupational health professionals, groups of symptoms that they feel are most important and most helpful in their screening program. For example, a list that might include a portion of the CDC recommended list, such as presence of fever or chills, cough or shortness of breath or difficulty breathing, sore throat, diarrhea, unusual muscle or body aches, and change in smell or taste. As you can see, that list is a subset of the complete list, but it tends to the more objective and easily symptoms that are more easily understood as part of a screening program. Other groups we're aware of, and some of the guidance include using fever, so objective fever or fever checking with, as I think was mentioned, a non-touch thermometer, or sometimes even feeling feverish is a fairly objective sign. And then groups of symptoms called such as chills, coughing, or difficulty breathing in the last 24 hours. And you saw earlier that the CDC meat and poultry processing working guidance specifically used that combination of suggestions as a screening program, that is fever or someone suspected of having COVID-19. And then secondly, in terms of implementing a screening program, you have to really have, as you plan, you really need to understand what type of immediate follow-up or occupational health expertise you might have on site. For example, in probably the worst case scenario in terms of the screening program, if someone screens positive, the advice would be they have to go home and seek care with their healthcare provider. Well, that's the least helpful both for the workplace and for the worker. So if possible, it would be recommended to have some occupational health expertise on site to provide kind of a triage or a secondary screening step with some clinical medical judgment to determine, well, if someone reports a headache, are they really, in the judgment at the time, likely to have COVID? And there's no right answer for this. There's nothing specific I can give you other than to say that, if possible, have some, if you're going to develop a screening program, have some occupational health expertise to allow you to make some of those judgments. And thirdly, every workplace should have a plan in place, ideally with some local health expertise if possible, for what to do if someone develops symptoms during the workday. We all know, and you all know better than I, construction workers can experience muscle aches, fatigue during their workday. And so some expertise advising on what those types, how to interpret those types of symptoms would be recommended if possible. So I hope I've given you in that brief discussion some practical ideas on how to think about symptoms and symptom screening. Now I'm going to just really briefly go into overview of testing. Very briefly, testing for COVID-19. You probably know there are two broad kinds of tests for COVID-19, including so-called viral tests, of which there are two types, PCR and the antigen tests, and antibody tests. The antibody test tells you if you have had a previous infection. Remember, I think that it's important to remember that not everybody needs a test. If a person is sick and, for example, self-screens themselves, they should stay home, separate themselves from others who are not sick, and seek health care, as needed. If they have mild illness, they may not need a test. The second thing to remember about the viral tests, both the PCR and the antigen test, is that they are indicators of infection status at one point in time. For example, if someone were tested at time 0, essentially any time after time 0, there is some risk of that person being exposed to the virus and becoming infected. So we should not assume, no one should really assume that testing is really something that solves the problem in terms of keeping by itself. One-time testing will not solve a problem of keeping people outside who might be infected from entering any particular environment, including the workplace. So I encourage, there is new CDC guidance that came out over this past weekend, just a few days ago, and actually it's, as we mentioned, they're already being revised because that's a constant process at the CDC, but basically there are 4 buckets of viral testing scenarios. So that means testing with the viral test, such as the PCR or the antigen test, and that includes individuals with symptoms, asymptomatic individuals who have known or potential exposure, or asymptomatic individuals in special settings. And I've listed a couple here, and actually this special setting list is something that's under active discussion because there are lots of different special settings where asymptomatic individuals may need to be tested or at least considered to be tested. And fourthly, from the clinical standpoint, a fourth bucket or type of testing scenario is to determine resolution of infection in persons who have been diagnosed with COVID-19. So I know I said I was going to end early and I was going to talk about contact tracing, but I think I will defer that at this point so that Scott has a chance to get to some questions. And I believe, or I know I personally would be happy to answer questions offline after the presentation. And I'll stop here, Scott.
Okay, thank you, Dr. Trout. Appreciate that update and the update from everyone else. Let me just go through a few questions here real quick before we hit the hour. First question is for OSHA, and it has to do with the general duty clause. Could one of the representatives from OSHA just speak to how the general duty clause applies to COVID-19?
Sure, this is Chris Brown from OSHA. Generally, OSHA is using the general duty clause in our existing standards to require employers to protect workers where those standards apply. The general duty clause, as you know, requires employers to provide safe and healthful working conditions for their employees. So that can mean a lot of different things depending on the type of workplace you're in and the type of operations that the employer is conducting. And that's one of the reasons why we've provided industry-specific guidance. What we have put out so far for each particular industry where we're covering is to try to give employers ideas of ways that they can get to that end point of providing that safe and healthful workplace by going through the process of doing a hazard assessment and implementing the hierarchy of controls, starting with engineering controls and then working their way through administrative controls and safe work practices before ultimately relying on any PPE that might be needed. So the general end goal there is like it is for any other hazard, to make sure that workers are being protected. And then in addition to general duty clause, just because I think it's relevant here, there are the existing OSHA standards for personal protective equipment, the general requirements, the standard for respiratory protection, our standard for sanitation that involves specific pieces of things that, depending on, again, the work setting, the type of work tasks that are being done, and the hazards that are present, include things that employers would need to do to protect their workers.
Okay, thank you. Quick question for Dr. Trout. Could you comment on the primary mode of transmission for COVID-19 and then also the utility of face masks and face shields in preventing transmission?
Sure, I'll take the first one first. So there was some confusion in the media 2 weeks ago in terms of surfaces and CDC's recommendation. Actually, getting back to what Chris Cain said, there is a tsunami of information. The CDC is constantly trying to provide the most accurate information, so they constantly edit their pages to try to make it more clear. So actually, there has been no recent change in terms of CDC's view on transmissibility. The primary and most important mode of transmission for COVID-19 is through close contact from person to person. Based on data from lab studies on COVID-19 and from what we know about other similar respiratory diseases, it may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it, and then touching their own mucous membranes or mouth or nose. But that is not thought to be the main way that virus spreads. So, just a aside, some of the media attention that was given to a quote unquote change about 2 weeks ago, really, there was no substantive change from the CDC standpoint. Over. And I think I'm happy to answer the second question, Scott, but I think OSHA has just a week or so ago published some FAQs on face shields and cloth face coverings. So would that be best for Chris or Tim to take, or I could try to paraphrase that?
Chris or Tim, would you like to address that? Or?
Sure, I can jump in. We did about a week ago add some FAQs to our talk about the use of various types of source control measures in comparison to things like surgical masks when workers need droplet protections or respirators when workers would need that type of equipment. FAQs kind of walk through some considerations about when ordinary cloth face coverings consistent with the CDC public health recommendation would be appropriate versus when employers might want to think about other types of measures that provide source control, like a face shield potentially could, but would not create or exacerbate workplace safety and health hazards like heat or the possibility of becoming contaminated when working around chemicals or issues associated with a worker being in a cloth face covering for the full duration of an 8, 10, 12-hour or longer work shift, depending on the industry and what the shift work looks like in that industry. So those details are laid out in the FAQ item, and I think if folks have questions looking through that, we'll actually provide a significant amount more detail that we can provide on the webinar.
Okay, thank you. Let's see. There was a question. This was for OSHA again. Is there a possibility that COVID training could be incorporated into OSHA 10 training requirements?
I don't know that we have any plans right now to change the training requirement to deal specifically with COVID-19. What we do have in place already are existing requirements for personal protective equipment and certain other standards that require employers to provide training about those control measures that have to be put into place in the workplace to protect workers so that workers know how to put on and take off PPE, how to use proper controls, what the risks of exposure might be, things along those lines. We're not intending to change the construction training requirements right now or any of the other OSHA hour-based trainings.
Okay, thank you. And then for Dr. Trout, I know you got to get going here, but let me just ask you one more question. What is the recommendation and supporting information for employees who test positive but are asymptomatic for working in construction and general industry?
So let's see. Test positive but asymptomatic. So, yeah, and there was a follow-up on there, I think. Is face, and importantly, I think where I'm going to get to this, the follow-up is face covering, hand washing, and social distancing acceptable, allowing the employee to work? The CDC recommends that people who test positive, even if asymptomatic, do not work. So there's no one who tests positive should be in the workplace, whether they're symptomatic or not. So that I wanted to make that point. first. So in terms of the recommendations for persons who test positive but who are asymptomatic or without symptoms, there's two strategies that the CDC recommends, and I'll try to summarize them, but they are on the website. I know saying they're on the website is sometimes not helpful because there's so much information, but basically there's two strategies. One is a time-based strategy. So if you test positive for COVID-19 but have not had any symptoms, the recommendation is you can return to the workplace after 10 days since the date of the first positive diagnostic test. So 10 days after you test positive, if you remain symptom-free, then you're considered to be no longer infectious from that related to that positive test. So that's a time-based strategy. So waiting 10 days past the positive test. The second way to answer that question is called a test-based strategy. And if someone tests positive for COVID-19 but has no symptoms, if they have at least 2 consecutive subsequent tests that are negative, greater than 24 hours apart, then they're considered no longer infectious. So there's 2 ways that the CDC recommends COVID positive persons but without symptoms return to work or remove themselves from self-isolation, the time strategy and the test strategy.
Okay, great. Thank you, Dr. Trout. Question for Chris Cain. Will employers need to start providing more power tools if they're not being shared? What kind of impact might this have on bidding?
Well, they will need to clean the power tools. There's some great guidance out there. Milwaukee Tools was the first to put it out. We have it in the COVID clearinghouse about cleaning and disinfecting tools. So definitely between users, they need to be cleaned. And I think this pandemic will affect bidding. And it's affecting the contracts that were written under previous bids as well. It's very, very difficult for contractors right now because they have to do more than they expected to control this hazard on the job site. So a short answer, yes, it's going to affect bidding in the future to have the proper controls in place.
Okay, thank you, Chris. And then let's see here, back to OSHA. What's the latest view from OSHA on COVID-19 and the OSHA 300 log?
Well, the requirements under 29 CFR 1904, the injury and illness record keeping and reporting requirements, remain the same as they were before the pandemic. We have some specific enforcement guidance to help our COSHOs who are dealing with this, and in turn help employers who are also dealing with this to try to figure out how you can go about making appropriate work-related determinations under the requirements of 1904. So, if an employer has to look at the facts of a particular case and look at what evidence is available to them and determine if a worker has a work-related confirmed case of COVID-19, as we've outlined in the enforcement discretion. So there's some definitions in there to kind of help employers figure out what work-relatedness might look like and what a confirmed case of COVID-19 means under the OSHA requirements. But again, the requirements remain the same. So to the extent that an employer would have to record a case of an infectious disease other than cold or flu prior to the pandemic, that expectation remains the same now.
Okay, thank you very much. And we're over a bit. I'm just going to follow up with one question for Chris Cain, and then one more question to OSHA, and then we can wrap things up. The question for Chris Cain is, could you comment on airborne transmission of COVID-19?
Yeah, I mean, I think that this is a contentious issue because at first we just believed this was a contact and droplet spread disease. Now the science is revealing that it is also airborne. And the difference between these things are, number one, for a contact or a droplet spread, you just need to stop the droplets coming out of people, and you need to clean surfaces. But as we learn more about this, we are definitely seeing that these viable virus particles do remain suspended in the air. They do have the potential to infect people. This doesn't just mean within 6 feet. There's no magical line for this, but much more likely in close contact and with droplet spread. But the potential is there for viruses to remain in the air and to cause disease farther away than 6 feet, as well as for prolonged periods. So I think this is an important distinction, and it does support the use of respirators in close contact versus cloth-based coverings that have no seal in place. And respirators under a full respiratory protection program, not just the slapping on of a respirator that may not fit the worker. So it does, I think, lend credibility to that position that that's necessary. However, there definitely is a role, I think, for cloth-based coverings and things like surgical masks to stop droplet spread. So you really have to kind of think about how to use distancing and other measures to keep people apart for this, because we do have aerosol transmission, and we have to recognize that as a nation. It's a very contentious issue between some people in the private sector and some people in the government and everybody in between, but the science is there. It's absolutely airborne spread. So we have to think about this very carefully.
Okay, thank you, Chris. And then the final question, and we'll wrap things up, but this is for OSHA, sort of related. Since asymptomatic workers account for about 30 to 40% of the cases, how effective is it to take temperatures? And then sort of related to that, if masks are effective, why do we need to do social distancing?
Well, masks are effective to a certain degree, but shouldn't be a replacement for social distancing by any means. And we're recommending a lot of different types of measures that employers need to be putting into place and making sure that their workers are adhering to in order to help control the spread of the virus. So, just because workers are wearing masks as source control or other types of PPE, depending on their work operations, doesn't mean that you should also stop social distancing. Those things really go hand in hand. The other thing that I wanted to mention there is that we're looking at adding some additional information to the OSHA website in the coming days to week. So I hope that we can ask for a little bit of patience. I know everyone the opening guidance and information about how they can go about planning for bringing workers back into the workplace. And our information is intended to complement the CDC recommendations on screening and temperature taking and things along those lines, and to put it into further context of OSHA requirements and workplace protections. So I think what you'll find that we'll be talking about when we do add that forthcoming information to the OSHA website is that screening and temperature taking are certainly strategies that employers can think about incorporating into their plans for reopening and returning workers to the workplace. But just that it's important to keep those in the context of what limitations are associated with them. I think the person asking this question kind of gets at one of the main concerns that we have in general, and that's that temperature taking won't necessarily exclude every potentially infectious worker from the workplace. And that really gets back again to the point of, just because you're doing one infection prevention measure, like trying to keep infectious people out of the workplace by doing temperature screening, doesn't mean that you should necessarily relax immediately the social distancing that you're doing or requesting that workers wear masks in the workplace. As the pandemic goes on and conditions evolve, employers really need to take into account the likelihood of transmission in their community based on the transmission we're seeing and what the case rates look like, and all of those other factors that are going to play into what the risk is for their workers in a particular workplace.
And I just want to react to something to what Chris Brown just said from OSHA. I think it's really important that, you think about trying to control this recognized hazard with all the tools in the toolbox. And if we can eliminate and have workers who are symptomatic stay home, we are engineering out part of the problem, but we have residual risk that remains because of asymptomatic and pre-symptomatic individuals. And we have to plan for that, and we have to control for it through the use of administrative controls like distancing and hand washing and disinfection. But we also have to recognize that we still have some risk that we have to control. And I'll end it at that. Thank you.
Well said, Chris. Thank you very much. I want to thank each of the panelists, including Chris Brown and Tim Irving from OSHA, Chris Cain from CPWR and Dr. Doug Trout from NIOSH. I also want to thank everybody who called in today for all your hard work during this difficult time. And I'm confident that together we can defeat this virus. So thank you so much. I look forward to connecting again in a couple weeks. Have a great rest of your day.